Dr. Amanda Roth, McLaren Lansing Primary Care, is joining us in studio today. Welcome, doctor.
Thank you.
Talk about, here we are in the peak of winter. What are you seeing right now in your office?
Yeah, so we're seeing a lot of sick people right now, mainly upper respiratory infections, which includes ear, nose, throat, most of which are caused by viruses. So there isn't a specific medication that can typically help those. A lot of times they're self-limited, meaning that the body will get over it on its own. So mainly we're treating with symptomatic care, so trying to make people feel better based on their symptoms, but their body typically fights off the infection on its own.
Right, and this is, we don't prescribe antibiotics when that's
Correct,
the case,
yes.
right? Right, gotcha,
Yeah.
because that just makes the super bugs, right?
Yeah.
we're giving an antibiotic for a virus, all right.
Right.
So talk about some ways that we can stay healthy during our winter months.
Definitely. So the most important thing is healthy hand hygiene. So washing our hands, making sure every time you touch a doorknob or something in public that you're washing your hands before you eat, before you prepare any food, those type of things. And then to prevent spreading the infections, making sure if you're sick, you're staying home.
Yeah, I'm a little bit of a over the top with the hand washing in my house. I'm like, did you wash your hands? You touched the doorknob. That's like, ah. But it keeps us healthier, right?
Yes.
All right, so what do they do when we're not feeling well?
Right. So if your symptoms are mild, you can typically, stay home, do those symptomatic cares, tea with honey for a sore throat, saline nasal sprays for sinus conditions, those type of things. If you feel like your symptoms are getting worse and you feel like you need to be evaluated, I always recommend people call their primary care doctor.
Yeah, as a primary care doctor, you are taking new patients, correct?
I am, yes, that's
All
correct.
right. Good, that's hard to find people. Hurry up. So I'm kind of thinking too about how long are we contagious? I'm like, all right, I'm feeling okay, but I still got a little bit of it going on. Am I being responsible by going out in public?
Right, that's a good question. Can sometimes be difficult to tell when we're contagious, especially if we're not showing symptoms. But a good rule of thumb is that if you're symptom-free and you haven't had a fever for 24 hours, you're probably not contagious at that point.
Okay, so symptom-free after 24 hours and wash your damn hands.
Yes, definitely.
What made you want to be a doctor?
Oh wow, that's a big question.
We've only had about 20 seconds.
Yeah. Helping people is something that's always been important to me, and the medical field's very interesting. It's a lifelong learning career. You're constantly having to stay up to date on things, and so I enjoy that aspect of it.
All right, Dr. Amanda Roth, thank you for joining us.
Yeah, thank you.